Board of County Commissioners for March 23rd, 2021. I'll take a roll call, please.
County Commissioners Actor, Bartlett,
Here.
Best,
Here.
Duffy,
Here.
Lazara,
Here.
Deputy Director James,
Here.
Director Lepore,
Here. Announcement of the open public meeting law.
Director Lepore, for the record, County Commissioner Actor mentioned that he will not be on this meeting. So
Okay.
he's excused. The open public meeting notice. Ladies and gentlemen, the notice requirement of the open public meetings law has been satisfied with respect to this meeting, specifying the time, date, and location, including the annual notice adopted at the reorganization meeting, filed with the county clerk, posted in the administration building, and mailed to 2 newspapers in accordance with the provisions of the law.
Please stand for the invocation.
O God, who provides for thy people by thy power, and rules over them in love, be gracious enough to bless thy servants, our county commissioners in the county of Passaic, that thy people may dwell in peace and safety through our Lord. Amen.
Amen.
Commissioner Duffy, could you lead us in the Pledge of Allegiance?
My pleasure, Director. I pledge allegiance to the flag
The United States of America and to the republic which stands
One nation.
under God, indivisible, with liberty and justice for all. Please remain standing for a moment of silence to remember the men and women who have died while serving in the United States Armed Forces. And also, let's keep in our hearts and minds the over 540,000 victims of COVID. Thank you. Have the motion to approve the minutes of March 9th, 2021.
I'll move it.
Motion made by Commissioner Lazara,
Second.
second by Commissioner Bartlett. Roll call.
County Commissioners Bartlett,
Yes.
Best,
Yes.
Duffy,
yes.
Lazara,
Yes.
Deputy Director James, Director Lepore.
Yes. There are no proclamations. You have the administrator's report, please.
Thank you, Director. This evening, we are honoring Women's History Month, and I will turn it over to Commissioner Lazara, who has a program and some really wonderful honorees here this evening.
Thank you, Anthony. This year for Women's History Month, the theme globally was women suffragettes, women who worked to get the women to vote. And when I thought about it in the beginning of last month, I said, I think we have bigger fish to fry. We need not only to recognize voting rights, which we will be doing tonight, but we needed to recognize the work that the women that we are honoring tonight embody just on an everyday schedule. Tonight, we are going to honor 6 women in 3 different facets. Beginning, I'll read them alphabetically. That's how we've been doing it. It's Dr. Jabin Ahmed, who owns Schieffer Pharmacy. We have Tracy Amato, a registered nurse at University Hospital. We have Dara Taskin from Taskin Bakery and Cafe in Patterson, New Jersey. Danielle Ireland Imhoff, Passaic County Clerk. Shona Mack Pollock, Esquire, Passaic County Superintendent of Elections. And Judy Heimer Van Wyk, who is a business owner in Clifton and owns Heimer and Company Stained Glass Studios. And we'll get more into the biographies as we go through the program tonight. So I am going to start with our two business women that we are recognizing tonight. Judith, or Judy.
I'm sorry, Commissioner.
Yeah.
Do we want to hear from our special guest first?
Oh, yeah, we do.
Hello?
Hello.
Hello?
Hi, Chairman. Can you hear us?
I can hear you. Well, first of all, Sandy, if I may, Madam Commissioner, I want to start for congratulating you as being the chair of Women's History Month. You've come a long way as women. You still have a long way to go. From 1920, from Susan B. Anthony, who started for the right to vote, right to the day that we now have a great woman that's Vice President of the United States. But you're still climbing. And I want to congratulate you, first of all, and your board on the outstanding job that you all have done, particularly to 2020 and these tough times. You've sure been there to serve the citizens of Passaic County. But tonight is a special night that we are honoring 6 outstanding women, and I want to congratulate them in their respective professions. I know most of them. I will be looking forward at some time to meet Judy. I understand that her stained glass company is right here in Passaic County. So, fellas, we got arranged to go visit her. And if we need stained glass in the county, you know where to go. But it's exciting day. I'm personally looking for an exciting year for all of you. As you know, that myself here in Passaic County and being state chair, I'm running quite a few women throughout the entire state. But I want to congratulate these 6 fine women that we are honoring this evening. They all deeply deserve it. And, of course, I've had the pleasure to work with just about all of them over the years. So, Commissioner Lazara, you take it away. I enjoy your program. And, ladies, again, congratulations.
Thank you, Chairman. Okay, so we're going to start off with our 2 business women that we are so happy that you could join us today. The first one is Judy Heimer Van Wyk. And I'll just give you a little background before we get started. Judy's family started the business in the late 1880s in Munich, and in 1935 came to Patterson. In 1949, they opened a new studio in Clifton and remains here till this day. Judy, you took over the reins in 1969. Heimer Glass Studio, or Stained Glass Studio, specializes in designs of windows and whatnot for churches, synagogues, and other religious institutions. Although you do some of retail and, businesses and residences.
Yes.
And you also, I know, do you fix and repair stained glass. You have works that can be found at St. Paul's Church in Clifton and St. Mary's in Pompton Lakes, and as far away as St. Croix, Alaska, and India. You were married, you had 2 children, and as women often do, they multitask. And one of the things you did was move next door to your studio and open a playground there for your a little playroom for your children, which was very enterprising of you. But unfortunately, as with all of us, a pandemic brought your business to a halt. And I'm really, I'm really knocked out by your ability that even though you had to lay off your employees, you continued to pay them, and that it helped having a PPP loan to be able to do that. And today you're operating again. I know you're working with 9 employees, and you're getting the work done and fulfilling your obligations. The other businesswoman that we are going to talk about today is Dara Taskin. Dara owns Taskin Bakery and Cafe in Patterson. She came to the United States from Turkey in 1995 with her mother and 3 sisters to join her father. She has earned a dual bachelor's degree in diplomacy and international relations and criminal justice at Seton Hall. Right now, she is completing her master's degree in diplomacy and international relations and master's in business administration. Pretty amazing during a pandemic and working in a bakery that reaches out to over 100 different businesses with bringing your bread and your desserts all over. So that's amazing what you're doing. You have 65 employees, mostly women, and you know what, this is so true for so many of you. You've given back to your community. You've delivered donations to mosques, churches, hospitals, students sheltering dormitories, and you've given free bread to those in need who come to your shop between 4 and 5 o'clock at the end of the day, and you don't ask any questions. You just give it to them. Dara also owns her own staffing and consulting company since 2009. And what she is doing with that company is helping businesses improve productivity, reduce waste, and increase profits. Dara also serves with me on the Passaic County status of women. You also serve, if I'm not mistaken, on, wait a minute, I got it here. And I can't see it now. Well, I'll get back to that. Anyway, and you've also been selected as one of the mentors at the first year of the Kobani Yogurt Initiative to mentor young people who want to go into business. So you've done quite a bit, and we are so happy to have the both of you here. And I will start with the first question for Judy and Dara. The pandemic has impacted all industries with significant hardships on those female-owned businesses. A recent poll by the United States Chamber of Commerce indicates that female-owned businesses are disproportionately affected negatively. So this is a two-part question for you. How did you maneuver through this past year and stay in business? And what are your expectations for the future? Dara, if you want to start off.
Thank you, Commissioner. First of all, I'm honored and humbled to be here. Thank you all. It's looking forward to hearing other participants and what they have to say. Even learn something from tonight from the fellow colleagues what advice or what they have done. During the pandemic has been tough on us. Even though people assume it's a bakery, the business is gonna be good, but our main income comes from wholesale. So most of the restaurants had been closed, especially the New York restaurants. Even though New Jersey, we were lucky to have 25%, 35%, now up to 50%, which the New York just recently had done. But it's been tough. As I had mentioned, most of our employees are women. So they are actually the bread makers of their family. And what was one of our difficulties is most of them became their teachers for their kids. So what we had to do was to work around their schedules to make our production timing so it's after school, because they had to be there to log in their kids, or some of them had to babysit their kids so their kids could go to school for their grandkids. So it has been tough, and our vendors, as many of has seen increase in prices also. So that was a huge impact on us. But what we had done is with our employees too, each day we had taken it slowly, and we had to give hopes to our employees, our even customers and our vendors to say, today is going to be the last day of the pandemic. So tomorrow we're going to start as a whole new. So this is just a dream. So we had to motivate each other. So that was one of our biggest things. So motivation was our biggest hope. And we as the society had to move forward. So that's what we were trying to do during this pandemic. And just sharing and between our community and the city and the county where we live and we work. And so that had helped us a lot. So that motivation is the key factor, I believe, during this pandemic.
Thank you. And Judy, what about you? How do you maneuver through this past year, and what do you expect as we move forward?
Well, for us, it was quite difficult because we can't really work from home. We're handcraft and everything has to be done in the studio. So when it was mandated that we close down, there was a lot of fear among our employees that they wouldn't get paid, that there would be a job when they get back, numerous things. Because when you talk about unessential entities, liturgical artists are pretty low on the list. I mean, we're very committed to what we do and have a great appreciation for the art, but when it comes to people starving and not being able to make their rent and things like that, we're really non-essential. So the PPP loan is really what helped us through the 9 weeks of closure and assured our people that they would have a job to come back to and would be able to continue in the profession of their choice. Since then, we've had to deal with various things, people contracting COVID and having to quarantine, setting up our studio in such a way that we are no longer working on top of each other, if you will, but have social distancing and just being much more conscious about washing, wearing masks, and all those sort of things. So,
what do you see going forward as far as your business?
It's hard. It's always been difficult in our line of work. We were very concerned that because we deal mostly with churches and people are hurting, there wouldn't be work when we came back and finished the obligations that we hadn't completed when we laid off. But what we found is that people have been rallying to their religious communities, and they've been donating to preserve their churches and to save their windows, and coming forward and donating windows in memory of loved ones and other families. So we've been fortunate thus far. And, with us, it's a month by month basis, wondering how things are going to go.
Dara, I just have a quick question. Do you see the need for your donations of food as significant now as it was maybe 7 or 8 months ago, 6 months ago?
No, there has been a decrease of needs. I mean, at first, actually, people were needed more donations. Actually, we were getting paid to donations to other churches or mosques or to other nonprofits also. So that has been done. I'm not receiving no payment in return for donations, but the donations we do as the bakery has been decreased because a lot of people at first did not know how to receive those donations and how to apply it too, because at one point everyone was donating. So they were over receiving too. And then I remember talking to a couple of hospitals or nonprofits, they're saying that stop, don't send no more. So I had those times too, saying, enough too. But compared to 7-8 months, definitely lowered.
Well, I thank both of you.
Yeah, and if I may add, I just want to thank the Passaic County with the workshops that you guys are doing to give advices that you guys have sometimes in monthly. So those help me or a couple other business to see what they can do too. So that has been helpful in addition to the PPPs that we had received and the grants. So that has been very helpful. So thank you.
Thank God, thank God. We're going to move over to our healthcare providers. Now we have one, Dr. Jabin Ahmed, who kind of crosses over into business because not only is she a doctor of pharmacy with a pharmacy in Patterson, Clifton, and East Orange, but she also owns Antica Grill Restaurant in Montclair and Astrogenics Labs. She served as commissioner on the Board of Social Services and is a member of the New Jersey State Board of Pharmacy. Jabin is always giving back. She does pro bono drug counseling and facilitates rehabilitation during the pandemic. While many of the pharmacies closed, Schieffer Pharmacy stayed open, full operation. And not only did they stay open, but they helped provide masks and supplies to the public at an affordable price. no price gouging at all, much of what we heard about. And she's donated masks, sanitizers, and PPEs to hospitals and public institutions. She provided PCR COVID testing at her pharmacy with doing over 800 tests a day. Dr. Ahmed is currently involved in research that will provide a 15-minute PCR rapid test and is prepared to do COVID-19 vaccinations at her pharmacy in Patterson. Also, with her restaurant, she's donated over 4,000 meals to Tony's Kitchen in Montclair to help feed the homeless, the poor, just distribute meals to anybody who was in need. Our second healthcare professional, Tracy Amato, has an amazing background. I mean, it's just amazing. Tracy lives in Woodland Park. She's married with 2 grown boys. She's been a registered nurse. I've known Tracy a long time. I remember when you went back to school to start studying to be a nurse. It was amazing. You used to work at St. Joseph's Hospital in the emergency room, and I think you still do per diem there.
That's correct.
You're also at University Hospital full-time.
Yes.
You spoke about the pandemic and how it affected you personally, being in the room if patients were dying. Just like what you've seen as far as families not being able to see their loved ones. You went from taking care of patients to administering vaccines with FEMA, and now you're working and teaching at University Hospital. I know that you mentioned in your biography that going home at the end of the day, you were more worried about your family than you were about yourself, taking off your hospital clothing in the garage, throwing it in the wash, not wanting to spread anything to your husband, your boys, and the rest of your family. Are you still worried about that?
I am still worried because unfortunately we all did get COVID around the holidays. So even though we had COVID, we don't really know what's happening with it. So we don't know if we can still get it again. So I am still worried. So I still come home from work and I still get changed. I'm not as crazy about it as I was in the beginning, because in the beginning it was like nobody was coming in my house with anything. Everybody was getting changed. Everything was wiped down, even groceries, because I was just terrified of them getting sick. So I'm not that crazy anymore, but yes, I still worry about if we can contract it again.
All right, so my question for Dr. Ahmed and Tracy are the COVID-19 pandemic has taken a toll on those in healthcare. We know that. And the healthcare profession significantly more than other professions. High-risk factors such as working with vulnerable populations in vulnerable workplaces, lack of proper PPE, and infected individuals had to have affected every facet of your lives. How did it affect you, and what stands out in your mind regarding your experiences during this pandemic? Dr. Ahmed, I'll start with you.
Sure, thank you so much. I think what was really important was, for me personally, just observing what was going on in society. There were people that came out and the best of them came out, and then there was a lot of greed and there was a lot of panic. And I think the most important thing and the most important lesson that I learned in this was leadership, and how it was important to stay calm and continue to do the daily functions and daily operations with wisdom and guidance. So there were a lot of people, a lot of professionals even, and I'm sure Tracy could attest to this, that were really panicking, and they were worried and genuinely worried about getting sick. And it almost affected their performance as healthcare providers. And I think it affected even physicians, even the greed affected physicians. And I think it was really important for us to realize that, this was an opportunity for us to be the best versions of ourselves and to stay the course and to guide through this with, and there was a lot of misinformation, but really try to cipher through the information properly and get to the, to the finish line. And we didn't get there, but for healthcare professionals like myself, I mean, we definitely were able to manage in a way that we could keep our operations normal, and we could still function in society and still help people and still provide for their healthcare needs and their medications.
That's amazing. You do God's work. Trey, what about you? What stands out in your mind regarding the pandemic?
With the PPE, it was short, and I remember we would come in the morning. We're only allowed to have one N95 a day, so they would give us paper bags to put our N95 in, and then we would take it home. And I used to have like all brown paper bags in the back of my car because I wouldn't bring anything in the house, but I would have all my N95s or my goggles or my face shields in paper bags in the back of my car, and then I would have to clean them daily until you go in like the next day. But people would be coming into the ER looking for masks, looking for everything. And, as Dr. Ahmed said, is that you didn't want to be greedy, but it was almost like, well, go to your own department to get your face mask, because we're limited to what we have, in the ER. But at the same time, you want to share it because, we want to protect ourselves. So the PPE was very stressful, but we had management at the time that was really, really on top of it. And they were just getting as much as they could. We also got a lot of donations. People would drop off PPE to us, a lot of N95s. I even had people, like friends and family, dropping it off at my house, and I would bring it to the hospital because they had stuff. I remember when we were doing the swabbing, I was working with FEMA doing the swabbing. It was very cold. It would start at 6 o'clock in the morning, and it was very cold in the beginning, the middle of March, I'd say. And they had the hand warmers and the feet warmers, the ones that you would use at your kids' games. Well, they had them at the site. And when I told my friends how cold it was, everybody went through their stuff. And before I knew, I'd had boxes and boxes of hand warmers and feet warmers that I was bringing to the swabbing site so we could share it together. But I think the PPE, it was bad, but we were protected. We were protected with that. But there was so many different things that stick out in my mind, about it, but we were covered.
I bet you could all write a book.
Yeah.
About your experiences. We're going to get back to some more questions. I'm going to hope my colleagues have questions when we're done speaking to everybody. Our next two honorees, Shona Mack Pollock, our Superintendent of Elections. She was appointed on May 31st of 2019 by Governor Murphy. Shona has a degree in law, and she's responsible for all of the enforcement of all election laws and ensuring compliance to those laws. It was a big deal this past year, as we all know, with all the talk there has been about by our, I don't even know how to say this nicely, our ex-president last president who challenged it over 60 times in court, the sanctity of voting. But if you want to talk to someone who knows about what happened, one of those people would be Shona Mack Pollock. Shona has served as the executive vice president and co-chairwoman of the Legal and Legislative Committee of the New Jersey Association of Election Officials. And she worked closely with them to make sure that fundamental rights to voting was maintained at all times. She also successfully held, in conjunction with our other honoree, Danielle Ireland Imhoff, and our Board of Elections, she successfully held 3 all vote by mail elections in a county, Passaic County, of over 500,000 people. They worked day and night. I saw them. They did. Listen, after the election, they worked on 18,000 votes by hand and got them done in 10 days. So every eligible voter was able to safely, fully, confidently participate in this past historic election that was amazing, and I know you worked so hard on that. And you worked with another one of our election officials, Danielle Ireland Imhoff, who was elected to the countywide office of Passaic County Clerk in November of 2018. Now, the county clerk is one of 3 constitutional offices that you have to be elected to. So it's the county clerk, it's our sheriff, and it's our county surrogate, who we're running actually this year. We have a county surrogate, Zola Casanova, who's running this year for surrogate. Her office is one of the busiest offices. I don't even know how you do it all. From recording records for property transactions to processing passports to doing veteran ID cards to processing vote by mail, ballot applications, tabulating election totals, and certifying election results. Your office is always so busy. And I think you have actually, do you have 3 different offices here in the county?
I have 2. I have the main office, which is in the County Administration Building in Patterson, and we have a satellite office that we share with the Board of Social Services in Wanacue. So it's convenient access for our up-county residents.
Yeah. So, I mean, and I know one of your major goals is to ensure a high level of accessibility to your office because there's so many things. And you also do notary republics, right? You swear them in. So there's just so much you do in your office. And you and Shona and Ken Herman worked together so hard this past year on the elections. You need to be commended for that. The 2020 election cycle was faced with unprecedented challenges to keep the election safe and secure. As election administrators in a county of over 500,000 residents, can you explain to us how you ensured a smooth voting process and how you responded to the new regulations and complications associated with vote by mail? Danielle, since I know you do the first part of it, I think, and then Shona kind of comes in with the election itself. So why don't you start and tell us some of the challenges that you had this past year?
Sure. Well, good evening, everyone. And it's really special to be honored by my home county and to be in such great company with the 5 other honorees tonight. Dr. Jabin, when you were talking, I actually had to grab a pen and write down your quote. You said that the opportunity to be the best version of yourself and for your team. That's how you took all of the challenges that we were presented with during 2020. So I want to just echo that. 2020 for elections officials was our opportunity to be the best version of ourselves. Elections officials, and I'm sure Madam Superintendent of Elections, she'll agree with me, we pride ourselves in being prepared and over-prepared, and no one saw the pandemic coming. What a lot of people sometimes gloss over, there are elections year-round. So last year, we administered 5 elections in Passaic County, not 2, not the primary, not the general, but 5. So my office has the statutory responsibility to design the ballots, to prepare and print all vote-by-mail ballots, and then to mail the vote-by-mail ballots to the voters. Governor Murphy declared that all 5 of these elections throughout 2020 would be primarily vote-by-mail elections. And, you know, at the beginning of 2021, when my team and I were reflecting, we calculated we prepared and mailed over 600,000 ballots with these 5 elections there. And just to put that into context, that is a 1,200% increase from what we did in 2019. So we really took 2020 to do exactly that, to be the best version of ourselves. And I really have to commend my office because they worked for months on end. We had the school board elections and a Patterson municipal election in May. Then we had the primary in July. Then we had the general election in November. So we start preparing in March for our school board and our municipal elections. So from March through December, because election day doesn't end in our office on election day, it ends a few weeks after. So from March to December, I have to thank my staff who just went above and beyond to ensure that every voter who wanted a vote by mail ballot and was entitled to receive a vote by mail ballot actually got a vote by mail ballot. And really quickly, one of the things that kept me uplifted and kept me motivated was thinking about my first time voting. I know we all can remember our first time voting. And then add to that your first time voting in a presidential election. We had to make sure that we did everything within our power to ensure that those people, first time voters, voters who are now voting for the first time in a presidential election, could walk away with a memory that they would be fond of, even though we were in the midst of the COVID-19 pandemic.
Wow. It's amazing. Shona?
I have to agree with everything Danielle just said. Thank you, Commissioner Lazara, and I want to congratulate all of the other honorees. This is such a wonderful honor, and I'm so pleased to be honored for something that I really enjoy doing. Like Danielle said, I enjoy going out to all of the students and engaging them very early on and making sure that they are have an opportunity to do something that is so fundamentally important, participating in the civic process and exercising their right to vote. Danielle indicated that the election process is year-long, and we were preparing for 2020 for actually a couple of years. We knew that this was going to be a historic election, but we didn't actually know how historic it was going to be. We were preparing for anything that could possibly happen for at least 2 to 3 years before 2020 actually took place. And the state and federal government partnered with us to implement a new statewide voter registration system. So at the beginning of 2020, my staff, along with the staff of the county clerk and the Board of Elections, we had already prepared for something that was going to happen, that was going to change our entire system. Which was the implementation of that voter registration system. We were also prepared for what the presidential election year was going to bring. But the pandemic changed all of that. My staff, and I, just like Danielle, I'm going to have to commend them. They embraced all of this, the spirit of cooperation. And I know that this exists not only in my office, it exists throughout the county. And I know it comes from the top all the way down. That is something that I take absolute pride in. There's a motto in this office: it's all hands on deck. And I've said it at least 100 times. I think we need to get t-shirts made because they just roll up their sleeves no matter what happens. It's all hands on deck. Guys, it's an all vote by mail election. We knew that meant more provisional ballots because the governor also said that all of the polling locations, at least one polling location in every municipality, was going to have to be open. So, we were going to have to make sure that people were going to be allowed to go to the polls and vote. Voters were not clear on what the process was. Voter education and voter outreach was also very, very important. And I commend our clerk who took the lead in that position. And we partnered together with the board to make sure that the voters, because this was a new process for everybody. Everybody was, rolling with the punches together. And we wanted to make sure that Passaic County had a successful election. And I want to thank the administrator and our commissioners who said, whatever you need to get the job done, we want to make sure that Passaic County maintains the integrity of this election, and that every vote that should count will count. And the outcome of the election is exactly the way the voters intended it to be. And we did it. We counted over 18,000 provisional ballots by hand within 10 days of the election. And I'm so proud of the work that we did with the assistance of our National Guard, who were absolutely awesome. We worked 16-hour days, and it was incredible to see how people it was awesome. It was really, really, they just geared up, they did the work, and they got the job done. And I'm just so fortunate for all of the work that we did together as a county. And I thank you all for your help.
We thank you.
Commissioner Lazar, if I could just mention one more thing.
Sure.
I want to just say exactly what Shona said. We had to think outside the box with everything that we had to handle as elections officials in 2020. And that creativity that was demanded from us, it meant that we had so much support that was provided. And I just want to say, one-on-one, thank you to you and your colleagues on the Board of County Commissioners, the county administration, county council, buildings and grounds. We had all of these ballots going out. We saw that the Postal Service was unreliable in 2020. That meant some voters never got their ballot in the mail. That means they're now coming to the county building expecting to get a duplicate ballot. And we had to do that safely so that my staff could stay safe and that the voters could stay safe. So Buildings and Grounds really just, did everything possible to make sure that everyone remained safe throughout all of those processes in 2020. And we truly, truly appreciate all of you and your team.
Oh, well, we appreciate all of you. Before I wrap this up, I'm just wondering, do any of my colleagues, anyone have any questions, comments before we wrap up? Okay. So we're going to wrap this up. And first of all, I want to thank each and every one of you who agreed to let me honor you for Women's History Month. In this day and age when women have so many things to juggle, and there's those universal qualities that many women possess, characteristics shaped by your environment, by your gender, by your strength of character, and the need, and I think you all feel this, the need to break through barriers, right? To make sure that you can survive at a time when there are unprecedented challenges against each and every one of you. You represent women all over the world, because the job you do is so significant to everyone. And we'd be here for days if we could just honor everybody, but you represent those women. You are so necessary, and so we embrace what you do, and we are here to support each and every one of you. I thank you so much for letting me honor you. I know, does anyone have their certificate with them? Can you just hold it up? You're going to be getting proclamations, by the way, but today you have your certificates because, we changed our names from freeholders to, they're beautiful. We changed our names from freeholders to commissioners, so we have to get all new paperwork. So you will be getting your proclamation soon. And again, I thank you so much. Thank you for being the role models for women everywhere. Again, go in peace, like I guess a priest would say that. Be healthy, be safe, and I know I'll see you all soon. Thank you.
Thank you.
Thank you very much.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye, everybody. Okay, Director.
Oh, hold on.
Director,
I still think the administrator has the
yes.
floor.
So, second on our agenda this evening is the update on the Passaic County response to COVID pandemic. We, of course, have another worthy, strong woman here in Women's History Month to give us the presentation of really what's to amount of a year in the life of COVID-19. So I think this report is going to encompass the last 12 months and what we have gone through, and more importantly, I think what we've accomplished as a county. So Dr. Gungel, as always, thank you.
Good evening, Mr. DeNova. Good evening, commissioners and everyone. It is my pleasure to give you an update of COVID-19 for the previous year. Micah, whenever you're ready. Okay. This is what our sites have looked like. On your right is the testing site at William Patterson University. On one of the days we were there, and you can see Mr. DeNova with the mayor of Woodland Park in the center with TJ Best, commissioner, also in the picture. To the left, you see a number of us. We were being visited by Mikey Sherrill. And on the bottom, you see a picture that also has the governor in it with Mr. DeNova and Commissioner Lepore and Commissioner TJ Best. Next slide, please. Oh, this should not be the next slide, but okay. This is just a picture that should have been further down in the slide deck to show you that we don't just talk the talk, we walk the walk, and also to encourage particularly people of color to get the vaccine, because we're seeing that there is a deficit there in Passaic County and throughout the state. Next slide, please. All right, early days of COVID. As you know, we've been through hundreds now of executive orders, but this is what it looked like. 102 to 107. March 21st was the day that we started to stay at home until further notice. So a lot has happened a lot happened in the first few days of the pandemic. Next slide, please. All right, here's an overview of the year at a glance. On your left are the difficulties we faced, and on the right are the successes. And I believe it was Tracy who mentioned about PPEs, and we can also extend that to ventilators and bed and also staff. One of the places that we saw a tremendous loss is loss of life with nurses and doctors and other healthcare workers. But the good news is on the other side, we were able to educate very quickly. We were able to explain and promote precautionary procedures such as social distancing, the use of a mask. We were able to jump right in, and Passaic County was at the front of this response, jumping right in with COVID-19 testing. And as you know, we went from testing in person to at home to continually testing. As of today, we continue to test, and we pivoted to vaccination. During all of this, contact tracing has continued. So again, difficulties, and on the right are some of the successes that we have accomplished. Next slide, please. This is an overview of cases in Passaic County as of yesterday. You're hearing a lot about the variants. As you see on this slide, we have over 56,000 cases in Passaic County. We have 2 of the New York variant, and that's as of yesterday, I believe, and 11 of the UK variant. And these 2 graphs, the graph on the left represents the cases of COVID from the beginning till yesterday, and the one on the right is the cases of deaths. So I wanted you to see that, to compare the two. The one on the right, you could see that with the beginning of the COVID-19 outbreak, our deaths mirrored or were almost the same as our cases. It was very dangerous. But again, I've talked about this for the whole year, but as you see the cases plummeted, you see the deaths plummet. And we only had a little bit of a rise in the fall of last year, but we've been able to stabilize, for the most part, our deaths here in Passaic County. Next slide, please. All right, our overall metrics as of yesterday, we have 1,576 people have lost their life to COVID-19 in Passaic. Over 5,000 people were hospitalized. Currently, our positivity rate is actually going down a little bit. It's 9.82 over the last 7 days of testing. And from 2 weeks ago, we did not have another case of a child with multi-system inflammatory syndrome. Next slide, please. We remain in the top 7 of impacted counties. Again, for most of the time, we were in the top 5, but Ocean and Monmouth has pushed us out of that. And I'm praying that we just continue to get pushed out of the top 10 is what my goal is, short-term goal. Next slide, please. However, we continue to bear a burden in terms of the cumulative incidence of cases. But now, instead of this slide shows you the top 6, but Hudson County is really pushing on our tails. So perhaps one day soon we'll be able to say that we're not at the top of that particular chain. Next slide, please. All right, so as you know, our response began with testing. And both pictures actually represent some of the work that we did at William Patterson University. Most of the people that you see in the white overalls, those are volunteers. And our volunteers were healthcare workers, just your regular person on the street. We had doctors, we had pharmacists, we had nurses, just a tremendous amount of support from our volunteers. Next slide, please. So this slide shows the percent positivity over the course of the year. Again, you could see early in the pandemic last year, we had a very high positivity rate, and that's the time when we were testing only people who who had a script for to be tested. Now we test everyone, and you can see in the middle there from about May till October, late October, we were kind of flat with positivity, and then it started to go up, and it's still low in comparison to where it was last year, but you can see a definite increase in cases and positivity over the last few months. Next slide, please. This is an overview of each municipality, and I'll make this available to their mayors to see how each municipality did during this pandemic. Next slide should be another similar. Next slide, please. Again, the other 8 municipalities. Okay, COVID-19 ICU and ventilation use. Right now, we're only at 18% of ICU bed use, and as far as ventilators, 53% of ventilators are available in Passaic County right now. So we're doing pretty well as far in comparison to where we were last year. But I have to tell you though, at last Friday at one of our meetings, a couple of employees from the hospitals, three hospitals in Passaic County, are concerned with the increase in people being admitted to the ICU and also the use of ventilators. So we have to watch that. Next slide, please. This is our overall epi curve for COVID-19. Next slide. This slide represents the people who tested positive for COVID-19 by race and ethnicity, gender, and age. I want it on one slide so you can just get an overview in one place, and I'll make the slide deck available to anyone who would like. And you can see race and ethnicity. 45% of the people represented self-identify as Hispanic. 27% self-identify as white, and other is 16%. And we've talked about other throughout this pandemic. To your far right, that graph shows that many of the people who tested positive are very young, 25 to 34, 18 to 24, 0 to 17. And we all know that even though they test positive, their symptomology is a lot milder than for the adults, the older adults. Next slide, please. Long-term care has been disproportionately affected by COVID-19. However, in Passaic County, again, we continue to see active outbreaks decline in our long-term care facilities, and that's a good trend. And we look forward to seeing no active outbreak in our long-term care. Next slide, please. All right, so let's talk a little bit about the vaccination program. So this slide just talks about what we received over the last week or so. We are now receiving Johnson & Johnson, which is called Janssen. So it's Moderna and Janssen. And sometimes you're going to see numbers are not necessarily matching up. And that's because sometimes with the Moderna, you can get more than 10 doses. But we continue to vaccinate. We have a very unique program where last week and up to Monday of this week, we went into the community to senior residences, to low-income senior residences, and administered the Johnson & Johnson vaccine there. We also are in partnership with the Passaic County Jail to vaccinate people who are inmates, as well as officers and other staff that work there. And those programs, the senior program, it has ended on Monday, yesterday, but we continue with the program at the jail. Next slide, please. All right, this is an overview of vaccination by municipality, the percentage that were vaccinated at our clinic. This is what this looks like. So you can see mostly Wayne residents and Clifton residents have been utilizing the clinic that's run by Passaic County. Next slide, please. All right, so this represents who is receiving the vaccine from our clinic, and you can see there that 10,596 individuals 65 and older have been vaccinated at our clinic. And I'm very proud of that because in many places and many of the meetings that I'm a part of, they talk about not reaching the population at risk. And Passaic County is doing everything in our power to meet the people, the older adults who are most at risk and who are the ones who are affected and who become very sick and who stand to lose their lives as a result. Next slide, please. All right, vaccinations continue. This is what it looks like in terms of who we're vaccinating. 81% of the people who we vaccinate at our site, meaning Passaic County run site, are Passaic County residents. There are 19% that are not, and they could be people who work in Passaic County and go to school in Passaic County. So we're reaching our population, and that is our goal. Next slide, please. Another way to look at our clinics is broken down by race and ethnicity. And you can see there that 79% of the population who we vaccinate self-identify as white. 6.79% choose not to identify. 4.6 do not recognize any particular race. Of the people identified, almost 72% self-identified as not Hispanic or Latino. Next slide, please. Clinic updates again. This is just showing you what it looks like. We were visited by Congresswoman Mikey Sherrill. The picture in the middle, you can see Miles Parr, who is one of the physicians that are involved in observing patients after they've been vaccinated. In the middle, you see Mikey Sherrill speaking to a constituent. Next to her is Commissioner Lepore. And this is the observation room after they've been vaccinated. Next slide, please. All right, so who we're vaccinating? In Passaic County, the breakdown between male, female, race and ethnicity, and so forth is on this slide. I'm happy to say that for the Black population in Passaic County, we've actually increased 1 percentage point. Last time it was 3% that we were reaching, and now the number is 4%. Next slide, please. This slide, sorry, this is for all the vaccines that are administered, not just in our clinic, but all the public health clinics, the hospitals, the long-term care, and every place that's being vaccinated. This is what this slide represents. Next slide, please. All right, so where are we in our goal? So our goal is approximately 267,000 Passaic County residents to meet that 70%, and we have completed 54,517 vaccines. So we're on our way. We have a ways to go, but it's not just us. We have many partners, and we're all in this together, and we're all working hard. The only issue is we don't have vaccines, but as soon as we get vaccines, we'll take it up a notch and we'll get the job done. Next slide, please. Our at-home testing continues. Again, same kind of profile as you've seen before. Next slide. This slide I think is important. It's a new slide, and it's a comparison between the 3 emergency use authorized COVID-19 vaccines. So you can get a copy of that to any one of you. As you see, the Pfizer and Moderna are both 2 doses, the Johnson & Johnson 1, and this goes through all of the effects of these vaccines, which I think is really important for us to know. Next slide, please. This slide is just to show you again an overview of where we've been in the county with our mobile testing. We've been to every municipality except 2, and we've been several times. So we try to cover everyone, bring the testing to their neighborhood as much as we can. Next slide, please. We've done over 45,000 tests with our mobile sites. And again, we continue. Today we did probably another couple hundred people. Next slide. This slide should have appeared sooner, but it's just to say how our response began with a tabletop exercise and that the William Patterson site tested over 16,000 people. Next slide, please. I wanted to end on this row, with this slide. This is Dr. Pruden, who used to be a medical director. As you know, he was one of the first patients to suffer from COVID-19. And the New Jersey Department of Health has a campaign where he was one of the people that they recognized because he survived. He survived a very, very bad bout of COVID-19. So next slide. Next slide, please. And that, ladies and gentlemen, is my quick overview of what happened over the last year with COVID-19. And the good news is we're in a good place. And I think that I pray that by the end of the year, we'll have Thanksgiving with our families and our friends and be able to, have a good time again.
May I ask one question, Dr. Gungal? Just one simple question. The numbers that you give, the stats that you give for those that are vaccinated in county, is that accounting for the people that may have gotten their vaccines outside of our county?
Yes, it is. It is people whose residences are in Passaic County.
Because that's the way it's reported to the state, correct?
Yes.
Thanks. That's it. That was my only question.
Dr. Gunhill, first of all, you're just truly amazing. Everything that you've done for the county over this past year and even before that, it's just amazing what you've done, and we hold you in such high regard. My question is this, it's a science question. New York has its own variant. How does a state get its own variant?
So usually with something like that, it is where it was first recognized and identified. So I'll give you an example. Lyme disease was first seen in Lyme, Connecticut, so they call it based on that. Or sometimes it could be the person who discovered it first. They would name it after that person. So in this case, it was seen in New York, so they named it the New York variant.
And has that been spreading much?
Now it is. Now it is. But the one that we're seeing most in New Jersey is the UK variant. We have many more cases of those throughout the state. I believe 140 something throughout the state. In Passaic County, it's only 11. The New York variant, you see a lot of it actually in New York City. But here is the thing: they're only tested for the variant if the person is not responding the way the physicians would expect the response to be to the treatment, and then they will seek perhaps something different. And so there's a whole process to get those samples tested for variants.
So do we know?
Does anybody know how effective the vaccines are with these variants yet?
That was my question.
So,
yes. 60 Minutes did a show that was absolutely frightening. That's why I'm asking.
So from what I understand, the 3 EUAs, the Pfizer, Moderna, and Janssen, are both effective in minimizing the symptoms and also minimizing the ability, the need to be hospitalized.
That's important.
Yes, because that's where we going to get into trouble when all of our hospitals are overburdened. So the whole idea is to be able to prevent people from needing that kind of extensive care. And all 3 vaccines have been proven to reduce that, visit to the hospital and staying in the hospital.
Great.
Thank you.
You're welcome.
Dr. Gungal, if I may, obviously the continuing question that we're getting from people that we hear from is the basic question is, how do I get an appointment? But the real question is about the flow and the rate at which we're able to get the vaccine out. You're in a lot of meetings, you're on a lot of calls. Any sense of what to anticipate in terms of the rate at which Passaic County is going to be able to vaccinate people, whether it's continuing with Moderna, whether it's the Janssen one shot? what do you see? Because the president has now indicated that all adults should be eligible by May 1st. What do you see as trends and what do you anticipate in the weeks ahead?
Okay, so I heard the same thing you did about the president saying, and as well as the governor. And I can tell you this, Passaic County is ready and able to vaccinate regardless of which vaccine of the three that we receive. We have the capacity to store and to provide the vaccines to our residents. So we are ready. However, we're not getting the vaccines. New Jersey's allotted so many vaccines and they divvy it up based on whatever formula. I'm not entirely sure, but I can tell you this. We are required to get those vaccines in arms by the end of the week. And so we schedule and we get those vaccines into arms by the end of the week. Because when we do that, we are assured that we'll get at least what we got the previous week, if not more. So the trend I'm seeing is that it's not so much a trend, it's more of an expectation that we're going to get more vaccines. It may not be next week, it might be the week after, but we're hanging in there and we're getting those vaccines into arms with the expectation that when we pivot to more vaccines, we are ready. Welcome.
Okay. Dr. Cungill, thank you so much as always, and keep up the great work.
Thank you. And thank you to my team who's listening.
Right. Director, that concludes the administrative report.
Thank you, Anthony. I just want to say, I want to commend Commissioner Lazara for the great job she did, and also Dr. Gunghill for the great job she continues to do. At this time, there's no communications. I'll take a motion to open the public portion of the meeting.
That motion.
Motion made by Commissioner Bartlett,
Duffy.
second by Commissioner Duffy. Roll call.
County Commissioners Bartlett,
Yes.
Best, Duffy,
Yes.
Lazara,
Yes,
Deputy Director James,
Yes.
Director Lapore.
Yes. At this time, I'll turn it over to our clerk to handle all the options available to the public for communication.
Micah is going to ask all the attendees.
I did send out the message about 15 seconds ago, just so you're aware.
All right. And then also, Director, we have not received anything, any emails at the public at PassaiCCountyNJ.org as of right now. So we're just going to check to see if any of the attendees on WebEx want to speak. We have a couple of our friends on there. Give them a second to respond.
Okay.
I haven't heard anything.
If I may, while we're waiting, one of the slides that Dr. Gunghill showed regarding a number of people that have been vaccinated, where she talked about our goal of 270,000 people need to be vaccinated, and I believe her slide showed 54,000 in total. Just I wanted to just clarify that. That's how many people we have vaccinated. Overall, in Passaic County, 106, almost 107,000 people as of today have been received at least one dose, and 56,000 people in Passaic County are fully vaccinated. So just it was a little misleading. Her slide only showing what we've actually vaccinated, but overall, the goal of Passaic County is 70% of the adult population, 270,000 people, and we're a little over a third of the way there.
Yes.
It's pretty damn good considering how long we've been doing it, because it's not that long. That's a lot of shots. And
First shot was given on New Year's Eve, December 31st. So
we are handling. I compliment all of you again, because we're handling it properly. We really are. Best we can do with what we get in. They're getting into arms very quickly. So,
and if they wind up flipping us over to a Johnson & Johnson, it's a game changer, because, you know, right now we're limited in terms of first dose, second dose, right? Some days we have 1,700 people that walk through the door because we have to 750 first dose and, you know, another 1,000 second dose. If, you know, the Johnson & Johnson, literally we could do 1,500 people a day.
Well, 3,000 doses.
Out fully vaccinated. So
right.
We don't know which way we're going. And honestly, the state doesn't know either. Although everyone keeps saying April, we should see the supply chain open up.
You know what I say to people? I don't care what vaccine you go for. If you get a call that, you know, you're registered several places, if they call you, say they have X vaccine, go.
No.
You know, don't argue it. Just go.
And we're seeing that because the rate of people not showing up for their appointments has grown over the weeks, because they make an appointment by us, they make an appointment at, you know, wherever, right? The Walgreens, the Clifton, Wayne, wherever it is, you know, people are desperate, and I don't blame them, right? So the first place that they can go, they get it.
Yeah.
But that's when we start backfilling with, you know, our lists of people and calling people in so as not to waste any vaccine.
Yeah, and there are various things out there that you're starting to see folks. Some of them are being called vaccine angels, where they'll put out a number, and anybody who doesn't know how to log on, you know, doesn't have internet access, etc., can pick up the phone. Some of them now are multilingual, so they're able to help people in Spanish, able to help people in Hindi and in Bengali and so forth. But Bruce, I think your point is exactly right, which is, you know, folks who have the chance to get a vaccine should get one. I sometimes hear people say, well, you know, this one's 94% effective and that was 95% effective. And I just say, you know, all of them are 100% effective against death from COVID. And they are very, very highly effective, as Dr. Gungel said, against hospitalization. So if you're trying to comparison shop 94 versus 95%, take what you can get into your arm.
Well said.
Director,
Yes, sir.
I'd like to read a comment in the chat room from Margaret Wood.
Okay.
I would like to ask you to oppose the TGB compressor stations that might be built in Passaic County. I live in West Milford. I do not want to live with toxins venting into my atmosphere. And that concludes, Director.
Okay.
Take a motion to close the public portion.
Motion made by Commissioner Duffy to close. Second by Commissioner Bartlett. Roll call.
County Commissioners Bartlett,
Yes.
Fest, Duffy, Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. Item L needs a two-thirds vote resolution. Resolution authorizing the chief financial officer to execute budget transfers between the 2020 budget appropriations, all as noted in the resolution. Need a motion?
I'll move it.
Moved by Deputy Director James, second by Commissioner Bartlett. Any discussion? Roll call.
County Commissioners Bartlett,
Yes.
Duffy, Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. Before I move on the consent agenda, there's number one on the consent agenda. I'd like to read it into the record and ask my colleagues to indulge me. This is a resolution condemning the murder of 8 people in Atlanta, Georgia area, affirming support for the Asian American community in Passaic County. Whereas on March 15th, 2021, 8 residents of Atlanta, Georgia were murdered in senseless killings, and it's being reported that 6 of the victims were women targeted because of their Asian descent. There are approximately 1 million Asian Americans residing in New Jersey, with large populations throughout Passaic County, 16 municipalities. And this diverse group of individuals and communities contributes to our county's cultural, racial, and religious diversity. According to a report from Stop AAPI Hate, a national coalition aimed at addressing the anti-Asian discrimination amid the pandemic, there are over 3,800 reports of hate incidents against Asian Americans across the United States. The board strongly condemns anti-Asian discrimination and affirms its support for all Asian American residents of Passaic County and pledges to support Asian American residents and families. This matter was discussed by the Administration and Finance Committee and being recommended to the board for approval. Now therefore be it resolved that pursuant to NJSA 4021, that the Board of Commissioners of the County of Passaic condemns the senseless murders and violence in Georgia and affirms its support for the Asian Americans residing in Passaic County. Let it be further resolved that the clerk to the board, county administrator, county counsel, and public information officer are authorized and directed to take all action necessary to carry out the purpose of this resolution and support the Asian American community in Passaic County. Let it be further resolved that the board pledges to work with elected officials and community stakeholders to address anti-Asian discrimination amid the pandemic and support the Asian communities throughout Passaic County. Thank you to my colleagues. And at this time, I'll take a motion on the consent agenda.
I'll move it.
Moved by Commissioner Lazara, second by Commissioner Bartlett. Any other discussion?
Just want to thank you, Director, for initiating that and for coming to me and talking about it. This is something that I take very personally because of my own family, and it's actually a colleague of Kiathy's, Dr. Russell Jung, who created the Stop AAPI Hate database that we referred to in our resolution today. So it's something that I'm proud to be part of a county that has stood up for the targeted and the vulnerable, back to our Syrian refugee community and even further back than that. And especially right now, unfortunately, that's our East Asian neighbors. And I appreciate that you initiated that, and I appreciate the board's support for it.
Thank you, Commissioner. Any other discussion? Roll call.
Also, Director, for the record, it's the consent agenda is M1 through M72.
Thank you for that correction.
County Commissioners Bartlett,
Yes.
Best, Duffy,
Yes.
Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. Need a motion on the personnel?
I move the personnel agenda.
Moved by
Second.
Deputy Director James, second by Commissioner Lazara. Roll call.
County Commissioners Bartlett,
Yes.
Duffy,
Yes.
Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. Need a motion on the bills list?
And I move the bills list.
And I'll second it.
Motion made by Deputy Director James, second by Commissioner Lazara. Roll call.
County Commissioners Bartlett,
Yes.
Duffy,
Yes.
Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. With that, I'll take a motion to adjourn.
Motion.
I'll move it.
Motion made by Commissioner Duffy, second by Commissioner Lazara. Roll call.
County Commissioners Bartlett,
Yes.
Best, Duffy,
Yes.
Lazara,
Yes.
Deputy Director James,
Yes.
Director Lapore.
Yes. Good night, everyone.
Good night, everybody.
Good night.
Good night.
please.